Bismillahirrahmanirrahim and Assalamu alaikum. Welcome to my channel. Okay, today I will discuss personality disorders. Personality is the way of thinking, feeling, and behaving that makes a person different from other people. An individual personality is influenced by experiences, environment, surrounding, life situation, and inherited characteristics. Okay, it is the definition of personality. What is personality? How you are thinking, who you are, and your perception about yourself. An individual personality is very much influenced by experiment, by experience, which he gained, and the opinion which he get from the others, and life situations. Everyone phenomena of life is changed by their experience and their personal views. Uh, a person's personality typically stays the same over time. Personality disorder is the way of thinking, feeling, and behaving that deviates from the expectation of culture, causes distress or problem functioning, and lasts over time. It is the definition of personality disorder. There are 10 specific types of personality. These can be a personality, they cannot be a disorder. We cannot say that these are disorders, but a disorder is a disorder or problem when it affects your personal life, it affects your daily life, then it become a disorder, then it become a problem for the individual and others. So let's start the type of personality disorders. Antisocial personality disorder, a pattern of disregarding or violating the rights of others. A person with antisocial personality disorder may not conform to social norms, not follow the traffic rules, break the rules, social norm, not following the normal type of dress that society accept, may repeatedly lie or deceive others, or may act impulsively, and it deviates from the others. He like in the cold season, all are wearing sweaters. The antisocial person is not wearing the sweater instead of a long dress. It is an example of antisocial personality disorders. When there is a funeral, the person is happy. Avoidant personality disorder, as its name indicates, a pattern of extreme shyness, feeling of inadequacy, and extreme sensitivity to criticism. These are the characteristics of avoidant personality disorder. People with avoidant personality disorder may be unwilling to get involved with people unless they are certain of being liked, be preoccupied with being criticized or rejected, or may view themselves as not being good enough or socially competent. They just live in their own life. They do not want to mingle with the people because they have fear of criticism. They do not like criticism. Everyone is not in a happy mood to get criticized, but these type of personality, they avoid people, and they are living in their own circle, and they avoid gatherings, and they stop going in gatherings because they hate criticism. Next is borderline personality. At its name indicate border, a pattern of instability in personal relationship, intense emotion, poor self-image, and impulsivity. A person has very much poor interaction personal in relationships. A person with borderline personality disorder may do not great lengths to avoid being abandoned, have repeated suicide attempts displayed. He dislikes others. He has poor control on emotions. He has poor self-image. That's the reason he wants suicidal attempts. He attempts suicidal attempts to ruin his or her life. It is the traits and characteristics of borderline personality disorder. The next is Uh, the next is schizoid personality disorder, being detached from social relationship and expressing little emotions. A person with schizoid personality disorder typically does not seek close relationship, choose to be alone, and seems to not care about praise or criticism from others. In schizoid personality disorder, the one dislikes social gatherings. He don't damn care about the criticism or praise get from others. Living in her own world and not like relationships. And they have their own thinking and their own world. They do not uh, think that what others are thinking about them. It is the traits of schizoid personality disorder. Then is schizotypal personality disorder, a pattern of being very uncomfortable in close relationship. They are very uncomfortable in close relationship, having distorted thinkings and eccentric behavior. A person with schizotypal personality disorder may have odd beliefs or odd peculiar behavior or speech, or may have excessive social anxiety, dislike social gatherings, can't tolerate people having their own world, and not like people, and they have their own beliefs, and they have their odd or peculiar behavior that is not acceptable, that is not according to norms, and they have their own social life, and they are living with the stereotypical personality disorder. They are living in the own world and they have very distorted thinkings. Their thinkings are not up to the norm, and they have very much problem in making close relationships. The these are the traits of schizotypal personality disorder. The next is the next is uh, diagnosis of personality disorder requires a mental health. We need a DSM for the diagnosis of personality disorders. This DSM is the key for the diagnosis, and diagnosis is typically made in individuals 18 or older. We can diagnose an individual in 18 or older. People under 18 are typical not diagnosed with personality disorder because they are in the developing position, or they are developing personalities. And the next is narcissistic personality disorder, a pattern of need of admiration and lack of empathy for others, just admiration of their self. A person with narcissistic personality disorder may have a gratuitous sense of self importance, a sense of entitlement, take advantage of others, and lack empathy. Don't care for others, just these type of personalities are just take care of their self. They are feeling that they are superior, and they have no empathy. They didn't think about others. And nowadays, this personality is day by day increasing. Now people just think about their self, and they damn care about the others, and they take advantage of others. It's this personality is nowadays common. People just take care of their self. People just give importance to their self, and we can see these traits are very much common in people, and nowadays this personality is increasing. The next is obsessive compulsive personality disorder, a pattern of preoccupation with orderliness, perfection, and control. This is the trait of obsessive personality disorder. A person with obsessive compulsive personality disorder may be overly focused on details and schedules, may work excessively, not allowing time for leisure or friends, or may be inflexible in the morality and rules. This is not the same as obsessive compulsive disorder. We cannot mix it with OCD. You can watch my video on the obsessive compulsive disorder. In this, the person is very much concerned about discipline, order. If the shirt is dirty, uh, why the it should be in the cupboard of washing machine. It should be in the basket of in the basket when where we put uh, dirty clothes. If the shirt is is pressed, it should be placed in the these type of different types of schedules. If the lunch time is 12 o'clock, it should not be 12:30. They did not tolerate mm, uh, they did not tolerate undisciplined. They just need perfection. If the glass is washed, it should be very much clean. If the utensils are washed, they should be very much clean. These type of people just need schedule and make excessive work. They did not take time to themselves and take leisure or friends. These are the traits of obsessive compulsive personality disorder. Paranoid personality disorder, a pattern of being suspicious of others and seeing them as a mean of spiteful. People with paranoid personality disorder often assume people will harm or deceive them and don't confide in others or become isolated. They are very much concerned if two people are talking, they think that they are talking about me. They are very much they are very much concerned that the other people will harm me, or the other people betray or deceive me. They have these are the traits of personality, paranoid personality, and they are very suspicious. If the black cat move from their side, they think why the black cat move. And if the two people are talking to each other, they think that they are talking about his or himself. And next, we will discuss the few symptoms of BPD. BPD stands for borderline personality disorder. There are the nine symptoms of BPD, borderline personality disorder. Fear of abandoned. People with BPD are often terrified of being abandoned or left alone. An unstable relationship, they have unclear or shifting self-image, and they are very much impulsive, self-destructive behaviors. They have self-harm, they have extreme emotional swings, and they have chronic feeling of emptiness, and they have a feeling of explosive anger. With the people with paranoid personality disorder often assume people will harm or deceive them, and people will harm or deceive them and don't confide in others or become close to them. They are living in their own life and they do not like the other people. They just live in their own life on in their own circle. Now we are talking about the treatment. What is the treatment of these personality disorder? Certain types of psychotherapy are effective for treating personality disorders. During psychotherapy, an individual can gain insight about and knowledge about the disorder and what is contributing to symptoms, and can talk about thoughts, feelings, or behavior. Psychotherapy can help a person understand effect of behavior on others and learn to manage or cope with symptoms to reduce behaviors causing problems to reduce behaviors causing problems with functioning and relationship. And the type of treatment will depend on the specific personality disorder and how severe it is and the individual circumstances. Commonly used types of psychotherapy include psychoanalytic psychodynamic therapy, dialectical behavior therapy, CBT, cognitive behavior therapy, group therapy, psychoeducation, teaching the individual or family members about illness and treatment and the way of coping. Psychotherapy can help a person. And the type of treatment will depend on the specific personality, how severe it and individual. And commonly, group therapy is very effective. Cognitive behavior therapy is very effective, and patient get rid of these disorders by these therapies. Commonly use types of psychoanalytic or psychodynamic therapy, dialectical behavior therapy, CBT, cognitive behavior therapy, because it's basically personality disorder are basically disorders of their thinking or their wrong thinking, and the CBT can be the best treatment. Group therapy is also very much nowadays common, and it is used for the patients. Psychoeducation, teaching the individual and family member about the illness. It is very important that other people or other family member know the symptoms of the personality disorder, so they will help the individual, and the individual will get recovery very quickly if the family is cooperative. Family cooperation is very much needed in the treatment of personality disorders. One can be treated very much in a good way when the family is cooperative and family give respect to the patient. Thank you so much. If you like my video, please subscribe and share. Stay blessed. Allah Hafiz.